and welcome to yet another episode of Guest Room. Today we have with us Dr. John Heyden, who is an anesthetist. Let's welcome him to the program. Welcome, Doctor.
Thank you, Nina.
First of all, we'd like to know more about you.
Well, my name is John Heyden, and I'm a medical doctor and an anesthetist by specialisation, and particularly I do heart surgery anaesthetics. I have been a doctor for over 25 years, and I have been involved with this area of neuroendocrine cancers for the last 10 years. I've both anaesthetised patients, but more importantly, I've looked after patients in my capacity as the co-founder of the Unicorn Foundation in Australia, and I run support groups with others in Australia to help patients. And also in my role as a member of the International Neuroendocrine Cancer Alliance. On top of that, I am involved in a number of areas of research in this area as well as others. So I guess I have many balls in the air that we're juggling, but the patient advocacy role that I'm involved with neuroendocrine cancer patients is an extremely important one to me.
Could you just tell us your experience in this field?
Well, over the last decade, I've been involved in neuroendocrine cancers. Firstly, with my sister, who passed away with a pancreatic neuroendocrine cancer, the same type of cancer that killed Steve Jobs of Apple. In that time, I've been, even though I'm an anaesthetist, I'm a doctor, but I've been a vocal patient advocate for neuroendocrine cancer patients, particularly in Australia, and now with my involvement in the International Neuroendocrine Cancer Alliance internationally, and hence why I'm here in India speaking at this conference.
Okay. So what is neuroendocrine cancer?
Neuroendocrine cancers are an uncommon group of cancers that arise from special cells that line the gastrointestinal system from your mouth down through to your anus and include the pancreas, and they are also involved in other areas such as the lungs and other organs. Most commonly, these cancers grow slowly and produce symptoms grow slowly in the gastrointestinal system and lungs. So there's quite a delay before they present.
Okay. So what are the symptoms of this cancer?
The symptoms of the cancers depend upon where they arise in the body. If they arise in the gastrointestinal system, the bowel or the pancreas, sometimes they present with abdominal pain, bloating, diarrhea. These tumours also secrete hormones. The endocrine part of that word of neuroendocrine means hormones, and these can produce symptoms such as wheezing or asthma-like symptoms, or flushing, facial flushing. Many of those symptoms, though, are common to other diseases such as irritable bowel or infective dysentery or something where you've got the abdominal pain and diarrhea. So it can be a little confusing for the doctor to diagnose them because those symptoms are more like other common conditions.
Okay. So how can we diagnose it?
This is a very good point. I think most of our patients, not only in India but worldwide, they often present to their local doctor on a number of occasions with the same symptoms. And despite whatever treatments that doctor may have given, it hasn't changed anything. So I think the main aspect is for the doctors who see these patients to think, if they've presented for the third time with the same symptoms, and no matter what they've done, they've got to think about, could it be something else like a neuroendocrine cancer?
Okay. So what are the treatments given to the neuroendocrine cancer patients?
The treatments given to neuroendocrine patients are varied. Ideally, if we catch this cancer early, surgery with cure is our main aim. Unfortunately for many of our patients, when they are finally diagnosed, this cancer has spread to the liver mainly and other sites, and therefore a lot of our treatments are looking at trying to control the growth of the cancer, such as we use injections of octreotide, we can use chemotherapy, we can use now what we call targeted medications that look at interfering with the cell, cellular mechanisms or way it grows. And also a very promising and well-regarded treatment is peptide receptor radionuclide therapy, which is a targeted therapy again, in which a radioisotope or a nuclear particle is attached to a protein, injected into the blood, and it's like a smart bomb. It travels through the bloodstream to the tumour and attaches to it. It doesn't harm normal cells, it attaches to the tumour and then irradiates it. So it's a wonderful treatment in which we hope that more patients can get access to worldwide.
So what are the challenges that the neuroendocrine cancer patients face?
The main challenges that the neuroendocrine cancer patients face are the need for early diagnosis and early recognition of the symptoms. And this really is important to educate a lot of doctors, because only a small number of doctors are experts in this field and understand it. So we really need to raise awareness of the cancer. And by doing that, we will hopefully get patients diagnosed earlier and cured by surgery. That would be the goal. Secondly, is these patients need access to treatments. And because it is an uncommon cancer, they don't have the resources or money available to treat them, unlike the more common cancers. And importantly, it's the third thing is, I guess we need to support these patients through patient support groups and develop networks, because it is uncommon. There may be only one patient in a village or one patient in a city, and they need to be able to connect and share their stories and help create a community where they support each other emotionally as well.
Okay. So how long you have been into this field now?
My involvement in this field has been over the last 10 years, initially with my sister and her journey with it, and unfortunately she passed away, and then subsequently starting the charity in Australia with my other sister Simone, and then my involvement in the International Neuroendocrine Cancer Alliance. So 10 years now.
Oh, okay. So what are the advices that you usually give to the cancer patients?
Well, currently there has been my advice is, to form a very solid and good relationship with your oncologist. And the main thing is the important thing is this oncologist needs to be, or this treating doctor needs to be a specialist in neuroendocrine cancers. And that specialist must have the access to what we call a multidisciplinary team. So that is a team of doctors and surgeons, physicians who are experts in neuroendocrine cancer management, who sit down and talk about the patient and talk about the different parts of their treatment and form the best possible plan to improve their life and to improve the length of their life. And so the multidisciplinary team with specialists in the field is critical to improve their outcome, because not every doctor understands this cancer.
Okay. So lastly, what is the advice that you would like to give to the audience?
Well, my main thing is to the audience is neuroendocrine cancers can present with common conditions such as facial flushing, asthma, abdominal pain, diarrhea, bloating. If you feel this has gone on for far too long, or you're not satisfied with the diagnosis you've made, consider a neuroendocrine cancer. So what we say internationally, if you don't suspect it, you won't detect it. So thank you.
So Doctor, that was nice talking to you. Thanks a lot for being
Thank you very much.
Thank you.
Thank you.
So that was Dr. John Heyden with us. Until we meet next time, this is me, Nana, signing off. Take care.